Good afternoon, everyone. Myself, Dr. Kirti, Assistant Professor, Physiotherapy Department. So, today I'm going to tell you about the parts of young bone. So, before that, we'll discuss some anatomical facts regarding bone. So, on the basis of development, there are two types of bone: membranous bone, first, which derive from the membrane, and the ossification is called intramembrane ossification. Example: the vault of skull, face, mandible, clavicle. And second, we have is cartilage bone. So the bones which originate by the replacement of cartilage, and this is known as endochondral ossification. We are having the long, short, and irregular bone as also shown in this figure. So the parts of young bone, the typical young bone ossifies in following parts. So first is epiphysis. The end and tips of bone which ossify from secondary centers are called epiphysis. They are covered by articular cartilage, and epiphysis enclosed in capsule of the joint. Types of epiphysis: pressure epiphysis, traction epiphysis, atavistic epiphysis, and aberrant epiphysis. So next, epiphyseal plate of cartilage. It separates epiphysis from metaphysis. Proliferation of this cartilaginous plate is responsible for lengthwise growth of a long bone. And after the epiphyseal fusion, the bone can no longer grow in length. Diaphysis: it is enclosed shaft of a long bone which ossifies from primary center. And metaphysis: the epiphyseal ends of diaphysis are called metaphysis. This is highly vascular. Metaphysis is zone of active growth. It is reach in blood supply through arteries from hairpin and blends. This is common site of osteomyelitis in children because bacteria is trapped in hairpin blends. After the epiphyseal fusion, it contains no more end arteries and no chances of osteomyelitis. So this is the diagrammatic representation of the parts of long bone. Like we in this picture we can see the epiphysis, this is the growth plate, and this is the metaphysis. This is the diaphyseal part, medullary cavity, and periosteum is the most outer covering of bone. So periosteum is the outer membranous covering which consists of two layers, inner cellular and outer fibrous layer. It has rich blood supply. So its function is to provide attachment surface for muscle, tendon, and ligament. Also having the nutritive function due to rich blood supply. It is osteogenic in nature, acts as a limiting membrane, means it prevents bone tissue from spilling out into neighboring tissue. Next, we are having the pneumatic or sesamoid bone. These are irregular bones, contain large air spaces. Example: maxilla, sphenoid, ethmoid. They make the skull lightweight in weight and act as air conditioning chamber for inspired air. Sesamoid bone, they are bony nodules embedded in joint capsule and tendon. It has no periosteum, covered with hyaline cartilage, and it is lubricated by synovial membrane and bursa. Example: patella pisiform. Thank you.